So what nutrients are most commonly lacking or missing for people that have metabolic disease and then are more likely to develop brain health issues?
Yeah, it's an interesting question. And to kind of make a comment on something you said earlier is that there isn't, psychiatric illness is very heterogeneous. So we know that diet and exercise can help with depression or other symptoms, cognition, things like that. That data is there, and that's from randomized clinical controlled trials. With looking at, we don't have like a single gene or a mutation or a lesion that we can point out for mental illness because it's a complex relationship of multiple genes and environment. But if we can improve, if there's this relationship between metabolic disease and mental health, and if we can improve some part of that population, then we're really helping, because it's heterogeneous. If we can focus on some population that is going to improve because there's abnormalities metabolically, then that's a pretty big win for our field and for our patients. So with regard to specific nutrients, I mean, some vitamins like iron or vitamin B12 sometimes can be abnormal and seen as abnormal, when we screen. And there are other important nutrients. Most of the time, what I see most of the time is that there's insulin resistance or higher inflammation, and just reducing the amount of carbohydrates, the refined carbohydrates especially, as well as the ultra processed foods. When that is decreased, then even the absorption of other food becomes better. And so you won't necessarily have low deficiencies or vitamin deficiencies. So that's a really big piece. And most of the time I do a lot of teaching with that. Another vitamin I do see that's low quite often is vitamin D. And there were some recent meta-analysis that showed that a vitamin D level, above 45, which hasn't been the standard of what we try to achieve, has actually shown decrease in mortality and increase in mortality if it's lower. So that's quite interesting. And we know that vitamin D plays a role in immunity. It plays a role in, as well as, with infection and with memory and concentration and even mood. So it's very relevant for mental health.
Yes. And most of the guidelines, the recommendations are based on levels that should be met to avoid the disease rather than to optimize health. So this is something to bear in mind. Yeah, this is fascinating. And so you talk about ultra processed food. Can you define that in more detail?
Yeah, so there's different categories of what we think of as processed foods, and ultra processed food is a category of foods where we're really looking at the kinds of things that are unhealthy, right? Those cookies are highly processed, or cakes or ice cream. Those are Coke. Those are things that we know inherently are unhealthy, and they're ultra processed. Now, there are other categories, like I was mentioning, of processed foods that, some amount can be processed, but I don't know that, we don't know that that's necessarily unhealthy as much as the ultra processed foods are. And we think that's the case because ultra processed foods raise glucose levels much higher and faster. And that is, in some essence, what we worry about with insulin resistance, and also what we worry about when it comes to addiction. So there's this idea of food addiction, and this idea of, well, we're shifting the glucose so quickly, and that means that we're also shifting other hormones like insulin. And what does that do to the brain? And we know that does directly and indirectly affects neurotransmitter levels, and it also affects dopamine reward pathways. And so that is a very, interesting area of study as well that we're looking at when it comes to overeating and binge eating specifically.
If you want to learn more about the science of epigenetics and nutrition longevity, check out my newsletter at Aronica.com and in the link below this video so you won't miss my upcoming free webinars, courses, and live Q&A.